All right. Hello, everyone. My name is Adrian. I am the Education and Community Liaison at the Nanaimo Brain Injury Society. And today we are recording our October education session. For those of you who didn't know, October is Occupational Therapy month. And so we have decided to invite an occupational therapist to come chat with us a little bit about occupational therapy and acquired brain injury. So I'd like to welcome Caitlin Ross. Hello, Caitlin.
Hi, thank you so much, Adrian. And thank you for reminding me it was OT month. Actually, your email jogged my memory about that. So I'm really happy to be able to speak with you guys today about two super broad topics, OT and acquired brain injury. So I'm just going to do my best to give a broad overview of both things and, give some food for thought and hopefully some resources. If you have more questions, folks are welcome to email me if they have any questions. And I did try to give a little resource sheet to Adrian as well that you're welcome to hand out to people. So briefly, we're just going to go over ABI, not too in depth because there's already an awesome Understanding Brain Injury presentation on the YouTube channel that I saw. Some basic principles of recovery and rehab, and then dive right into what is occupational therapy, what might assessment and treatment look like with an OT for acquired brain injury. I'll go over some common barriers to occupational engagement after ABI. And occupational engagement, I just mean the ability to do the things that you want to do and need to do in a day. And we're also just going to look at putting it all together with activity patterns, routines, and pacing over the day and over your recovery. So briefly to introduce myself, my name is Caitlin. As Adrian said, my pronouns are she and her, and I'm a white settler living and working on Nuu-chah-nulth territory. So today I'm speaking to you from Ucluelet. I'm a graduate of the McMaster OT class of 2018. And my first job was actually in workplace rehabilitation, where I did a lot of work with persistent pain, concussion, brain injury, and mental health. And currently I work in the public health care system in West Coast mental health and substance use. On the right-hand side, I just took a chance to list some of the occupations that matter to me. I'm not necessarily good at all of these things, which is important to note. You don't have to be good at something in order to like doing it and to have it be an important, meaningful activity for you. And sometimes we just go about our life and we haven't maybe thought about this. But if you're watching this, just start trying to reflect on what are those things that you do over a day or a week that make you feel like you and give you a good quality of life and things you look forward to. So yeah, all of these things, if I wasn't able to do them, or if they suddenly became much harder, I would start to have a much harder time and feel very differently about myself. So if you took all those away, it would impact my health and well-being. Next, I briefly just want to say acquired brain injury. It refers to any damage to the brain that occurs after birth. So to me, that highlights that it's a big transition. It's not something you were born with, and it's not how you're used to doing things. Causes include traumatic injuries, seizures, tumors, events where the brain has been deprived of oxygen, infectious diseases, and toxic exposures. So that brief definitions from Brain Injury Canada. And I also want to highlight when they're talking about the brain being deprived of oxygen, we are seeing more and more of these hypoxic or anoxic, so not enough oxygen to the brain, injuries after substance use, so like overdoses, drug poisonings. We're seeing a lot more folks with brain injury from those types of events. On the right, you can see just some of the effects, how broad they are. There's nothing that your body does that doesn't involve your brain. So the potential effects of brain injury are physical, emotional, cognitive, and behavioral. Again, I'm not going to go too in-depth on these because they are covered really well in the Understanding Brain Injury presentation. But I want to highlight that all these little clusters of symptoms or things that could be affected by a brain injury, they add up to produce your daily function, how you go at your day, and your quality of life, how well you feel things are going. And for me, the things that I work the most frequently in my job are the emotional and cognitive domains. So you can see under the emotional category, it's really common to have more emotional lability or lots of ups and downs. You might be really tearful about something all of a sudden or really angry, and those moods can switch really quickly. As well, there are much higher rates of PTSD and major depression in civilians with acquired brain injury, as per this 2019 study, and much higher rates of suicide. So this study from 2018 shows us that it's 1.9 times the rate of the general population. So that's almost twice as high. And those rates are even higher with more severe brain injuries and within the first 6 months after injury. So to me, that's saying, like, yes, people die by suicide when they're depressed, but also people die by suicide when they feel like they can't cope with their circumstances and they don't feel hopeful. So to me, I think OT can help with that because we're really trying to build up meaning in your life and get you back to doing those things that make you feel hopeful and keep you busy and make you happy. As well, the cognitive domain, there's so many processes that happen in your brain that impact how well you can do everyday activities. So it's listed out: attention, working memory, long-term memory, all your 5 senses, your social cognition, how quickly you can understand things. I can be a fast talker, so you might be watching this like, whoa, I need more time to process what she's saying. And your executive functions like planning, organizing, problem solving, and concentrating. It's a really long list, but OT, the really important part is thinking about how does this affect you every day? So everyone in your life might not be able to see that your cognitive processes have changed. What they'll see is that trying to have a long conversation with you in a crowded place with lots of background noise isn't going the same as it used to. And they might think like, oh, this person's disinterested in what I'm saying, or they don't care, they're not paying attention to me. Really, it's a cognitive process that has been affected by brain injury, and there's things that we can do about it. But yeah, just keep thinking about how these things would show up and impact the things that you have to do and want to do every day. So briefly, I'm going to look at some rehabilitation considerations because yes, this can sound really overwhelming, but there is a process of recovery and growth that happens afterwards. So I don't ever want anyone to feel hopeless or too overwhelmed by all these changes. So recovery happens in ourselves, and everyone's injury is different. So you might have, a concussion from playing soccer. You might have a severe brain injury from a car accident, or like we mentioned, those hypoxic or anoxic injuries from a drug poisoning. Our personal resources and histories are different too. As well, brain injury intersects with our other identities. So it matters if you're a person of color, if you're a queer person, if you have other disabilities that you identify with, they're going to have a compounding effect with brain injury. And everyone's values are different. So your experience isn't going to be exactly the same as anybody else's. Your environment's different too. So depending on your injury and your circumstances, you might get some treatment in hospital, in community centers, outpatient rehab. If you have some higher support needs, you might also encounter residential care. Your resources are different. How much money you have. Does your job have you give you benefits? Are you eligible for EI? Do you live in a small place with no hospital, or do you live in a big urban center with lots of resources? And your social support, who's around you, supporting you in your daily activities matters as well. And occupation. So my list of occupations that matter to me, probably not the same as the ones that matter to you. So again, very unique. Recovery also isn't linear, so it doesn't just get better in a straight line like this. There's a lot of ups and downs, but the general trend should be that things get better when you zoom out and look at the big picture. So on the right, I did just note a few common places where you might be able to access some rehabilitation services, including OT. And again, a community group like the Brain Injury Society is a good place to start to help navigate if you don't have like a strong case manager or a really good GP on your side or something like that. There's really good brain injury guidelines available as well. So the Ontario Neurotrauma Foundation has guidelines for concussion, pediatric concussion, and moderate to severe brain injury, but they also make client or patient versions of the handouts as well. So I use them in my clinical practice, but you can also use them in managing your own recovery. And the Tall Tree, which is a private clinic in Victoria that developed a concussion program, they have their recovery guide available for free online if you want to work through some things on your own. So again, just highlighting that we come from a very independent focused society. But in disability studies, so crediting Patty Murren, Mia Mingus, and Stacey Milburn, who are all queer women of color, disabled queer women of color, who coined this idea of interdependence as part of disability justice in 2005. We are all interdependent on one another. I don't fix my own car. Sometimes I don't make my own lunch, and I work in a team that helps me get things done every day. So it can be really hard having to accept more help than we're used to, but remember that it's normal to rely on others. And we also often have to practice a lot of self-compassion in recovery. So we might have an idea that we need to be hard on ourselves, always working, pushing through things in order to get better. And yes, it is hard work and we do want to progress forward, but being too hard on yourself won't actually help you get better faster. So you want to think about all these three key concepts of self-compassion, as well as the two sides of it. So being able to soothe and comfort yourself, as well as acting bravely in the world. On the bottom right, I did put some resources if you want to look more into it. I definitely recommend just the quick half-hour podcast, The Power of Compassion, as a good starting point for that. So finally, after all that, I'm going to get into talking about occupational therapy. So an OT is a registered healthcare provider. In BC, we are supervised by a college called the College of Occupational Therapists of British Columbia, COPBC. And we're basically just interested in the business of everyday living. We believe that everybody has a right to participate in activities that they want to do or need to do in order to live a meaningful life. We're experts in enabling occupation. And this is a loose quote from one of my favorite professors, Sue Baptiste, who, when she was orienting our OT class, she told us occupational therapy is not something that you can do to somebody, it's something that has to be done with somebody, which is why it's not really one clear definition ever. It's very collaborative. So our basic assumptions, the two big ones are that human beings need occupation and that occupation has therapeutic potential. So we know that occupation affects our health and well-being. As I said, if you took away all those things I do in a day, I would not feel very healthy or well. It organizes our time and brings structure to living. I always think about kind of when you get a sick day as a kid, or even now, it's really exciting at first, and then you reach this point of getting really bored because you're craving that structure for your day again, because the things we do bring meaning to our life. As well, occupations are idiosyncratic. That just means that they are unique to the individual. My favorite occupations don't have to be the same as yours in order for them to be meaningful to me. So if you encounter an OT somewhere along the line of this recovery, whether it's in hospital or you were sent an OT by ICBC after a car accident, the first step is always going to be a comprehensive assessment. And ideally, an OT is just one member of an interdisciplinary team that's helping you. So we're going to look at a lot of stuff, but if we flag something that might be a barrier to you getting things done, we might not treat it all, but we'll try to make sure that you get the right referral. So in our assessment, we're going to consider the person, and that includes your spirituality, your cognitive capabilities, your physical capabilities, and your emotional health as well. We're going to consider your environment, physical, social, and cultural, so your family, your house, where you work, where you live, and we're always going to prioritize and focus on meaningful activity and occupation. That includes productivity, like, yeah, we want you to get back to work if that's what you want, as well as self-care, being able to bathe, groom, sleep, rest, all that stuff, and leisure. So we want you to have fun, and we want you to have a balance between these three things all the time. As well, just know that if I'm looking at some component of you, if I'm looking at your cognition, or if I'm looking at your muscle strength, it's because we're thinking that that's something getting in the way of you doing an occupation that matters to you. So at every point, even though the assessment's really broad, we want to bring it back to the activities that matter to you. As well, always make sure your OT is looking for your strengths. So we want to build on your values, your strengths, and your priorities, as well as flagging some of the challenges so that we can work on fixing them. This information from the initial assessment is going to be used to set your goals for your treatment plan. And that's important in occupational therapy, but it's also highlighted in brain injury recovery guidelines that you want treatment to be driven by a person's unique values, goals, and priorities. So when I set goals, this is a little OT trick, a little rehab trick. I use the SMART goal format. That stands for specific, measurable, attainable, relevant, and timed. Often the first time I sit down with someone and I ask them about their goals for treatment, people will be like, well, I just want to feel better, or I just want to get back to normal, which is great, but I don't know what your normal is. I don't know what your better is. So we have to take some time to define that a little more specifically. So for myself, if I was working with an OT who was trying to get down to the specifics, I might eventually be like, okay, so one thing I'd like to do more of is I want to go snorkeling with a friend again. I want to make it measurable. So I'll go once per week for 30 minutes. I can look at the end of the week and see if I did that or not. Attainable, so I'm 9 out of 10 confident that I can go one time for half an hour. Relevant, it's relevant to me because I like it, I picked it, I live close to the beach in Yuki, and it's timed. So I know I'm gonna start next week and that I'm probably gonna do it after work or on the weekend. So goal setting though, and behavioral change is really hard. That's one thing we know for sure. So you really want to choose things that are important to you that you want to do. You'll be working on skills that'll help you in all your other occupations too, so you might as well choose something you care about to start with. As well, you want to know your own activity patterns. If you're not a morning person, do not set your goal to happen at 6:30 in the morning because you'll probably just snooze your alarm, sleep through the goal, and feel bad about yourself. So another thing you can do to make sure that you accomplish the goal or that you get started is to use something called activity linking. If there is something in your routine that you always do, just stack the new activity on top of it. So I always make coffee when I wake up in the morning, and I make it in the French press and it sits for 4 minutes. So if my goal was to practice belly breathing, I would say, okay, I'm going to set the coffee up, set my timer, and I'm going to use that 4 minutes to do my deep breathing. Again, if you're not at least, I'd say 8 out of 10 confident that you're going to meet your goal, just break it down and make it easier. We always want you to be experiencing success and setting goals in small enough chunks that you know you can meet them. That's really good for our brain. It releases dopamine, it builds our self-confidence and self-efficacy and hopefulness. If your goal is too big, you kind of risk two things: that the goal might seem impossible, so you never get started. Kind of like if I set a goal to go climb Mount Everest next week, why bother? I'm not going to do that. Or you might get started, try it, but not reach your target because it was too hard. And then you feel bad about yourself, self-critical, which causes a threat response in us, which usually leads to fight, flight, or freeze, which are not modes where we can be working on our goals. So again, practicing self-compassion and making your goals attainable is really important. I always ask myself when it feels hard, what is the first easiest step I can take? And just making that step your first goal. So some of the common barriers to getting things done after a brain injury. A huge one is fatigue. People talk about that a lot. And again, it's one of those like invisible disabilities that other people can't see and other people might not understand. And you might feel pressured to do more than your body's actually capable of right now. So a myth would be that you're lazy, unmotivated, or not trying hard enough. The fact is, your brain is working harder than ever. These slides of brains are a really useful teaching tool in concussion rehab. So they did a functional MRI, oops, and my PowerPoint's off to the races. Okay, so they did a functional MRI, which means it's taking a scan of someone's brain while they're doing a task. So in the brains on the left, they're doing a subtraction exercise. And I'm hoping the rights and lefts are the same when we all look at the screen, but on the left you can see brains without concussions, the ones that are more gray. The orange and red parts are brain activity, so how much of your brain is working when you're trying to do this task. Without a concussion, you know, you have some activity and working memory and motor planning, but the rest of the brain is just kind of resting. After a concussion, you can see there's so much more of your brain working really, really hard to accomplish the same task, which is just subtracting numbers. The other ones, it's a right finger sequencing task. So basically someone's just being asked to tap the fingers on their right hand in a certain order. Without concussion, you are getting some activity in motor control, but after a concussion, you see way more parts of your brain are lit up, and it's way more effort to monitor that. So it's not in your head in that you're making it up, it is in your head in that your brain is physically working really hard after an injury. I also like to think from the OT perspective, subtracting numbers or tapping your right fingers, those are tasks. They're a tiny component of a meaningful activity. So if that's how much your brain lights up just trying to subtract numbers, imagine how much it would light up if you were trying to pay your bills or budget or go to the bank. Again, it's a myth that you need to push through this pain or fatigue. The fact is that you're working really hard, so you need a little bit more rest. You need to balance pushing into these symptoms and then resting to recover throughout the day. So again, another reason why it's important to practice self-compassion. People often also find that sleep is an occupation that is affected after a brain injury. So people might sleep more than usual or not be able to sleep very much at all. Either way, you can work with an OT on some sleep hygiene and even some CBT for insomnia type skills. So we look at sleep restriction therapy, which means limiting the amount of time that you spend in bed to the time that you're actually sleeping. So if you spend like 9 hours in bed tossing and turning, but only 6 of that is sleep, we're gonna train you to just stay in bed for that 6 hours you're sleeping and then gradually increase the time spent in bed over time. You never, though, want to spend less than about 5.5 hours in bed, because less than that is sleep deprivation. You also can work on stimulus control therapy. So just training the response between your body and bed, that means it's time for sleeping. So they say the only occupations or activities that should take place in your bed are sleeping, sickness, and sex. Nothing else. Don't eat in bed, don't watch TV in bed. Sleep hygiene education is something you can do with an OT that looks at your environment, your routines, your thought patterns related to sleep, everything like that. And you can also practice some relaxation skills. So diaphragmatic breathing just means belly breathing. The easiest way to practice that is to have a hand on your chest and a hand on your belly and train yourself to just breathe. You can't see my belly trying to like breathe in my high-waisted jeans, but I am working on it. So just breathe through your belly. That's a big efficient muscle, your diaphragm, and it's a much calmer way to breathe that slows down your nervous system and makes it easier to sleep. You can also work on progressive muscle relaxation. So progressively like clenching and then releasing all the muscles in your body to relax. There's some apps listed at the bottom of the slide that can train you how to do these things. You can also look it up on YouTube and there'll be lots of support for that. You also want rest throughout your day. So you can have relative rest, switching from a really hard activity to one that's a bit easier. Like after going to work, you might just want to work on a knitting project for an hour to give yourself some relative rest. But you also want periods of absolute rest where you don't have a lot of stimulation. Take some planned breaks in your day, whether it's just closing your eyes for 5 or 10 minutes, going for like a quick walk or to sit outside. You can also use a timer if you feel like, oh, if I start resting, I might never get back to the activity. Rely on external strategies too. Most of us are really bad at resting. And so people will be like, oh no, I was just doing some light tidying, I was resting. No, you were doing productive chores. Or I rest all the time, I watched like 7 hours of TV. That sounds more like hitting a wall and zoning out rather than actually getting restorative rest in your day. So physical recovery is not something that I work in as much anymore, but you're going to look at remediation strategies. That means improving your muscles, maybe working with a physio or a kin, and practicing activities you want to get better at and improving over time. But you also might see compensatory strategies. So if something's not getting better as quickly as you like, or it's not expected to, you can rely on something else. So you can modify the task to make it easier, or you can use adaptive equipment like a wheelchair, or if you have trouble gripping, built up handles, that type of stuff. Lots of OTs work in this area. I don't, but that is one classic time when you might encounter an OT. So they would set you up with all the equipment and strategies you need to do something that matters to you a lot, but physically you can't do it anymore since an injury. I do see a little bit more cognitive barriers in my job. And again, same principles. We're going to look at compensation and remediation. Compensation, again, changing the task, making it easier, taking distractions out of the environment to make it less demanding for you to be able to pay attention and focus. You can also learn some internal compensatory strategies like self-talk, cueing, little tips and tricks that you can use to keep on track. You can also use things like schedules, organizers, reminders from other people, post-it notes, putting things where you can see them, like having a dish by your door with your keys and your wallet and everything you need when you leave the house, instead of having to use your brain power to remember all that every time. I did have a client who really liked using this Cozy Family Organizer app, and this highlights, I think, that idea of interdependence, because they would plan things collaboratively with their partner, but they both had access to the app, so they could work on using that strategy together. Something that's coming up a lot more. So when I was in OT school, they didn't really teach us or emphasize cognitive rehabilitation or remediation that much. We focused more on compensation. But the more we learn, the more we're saying neuroplasticity. So the idea that your brain can change is a really important part of rehab. And it is possible to have positive changes happen in your brain. And we do have some control over that. So don't ever let anyone tell you that you don't have any control over that, or that it's not worthwhile to work on this. The two things that I think they're finding are really important, though, are, yeah, it's good to practice cognitive strategies and identify them, like doing, say, a computer task that helps to train your attention, or a puzzle that helps with your planning and spatial skills. It's important to practice that in a calm, quiet environment. But what's really important is to make that link of how it applies to your everyday life. And that's where an occupational therapist can be helpful, I think. Otherwise, we'd all just do little brain games on our phone and it would translate perfectly. The other thing, and this diagram is kind of complicated and intimidating, even to me, but I hate to admit it, the other thing that helps with neuroplasticity and improving our cognition is cardiovascular exercise. So this is a model of neuroplasticity produced by chronic aerobic exercise, which makes it sound like a disease, but it just means that you do cardio frequently over a long time. So you can see over the long term, there's all these changes that happen in your brain at the level of molecules, cells, and the actual brain structure itself that produce behavioral changes. And the behavioral changes they're looking for is improved cognitive and motor function. I wasn't able to find anything about a specific protocol for how much you need to exercise for how long in order for this to take effect. But what I will say is something is better than nothing. Again, with the goal setting piece, you don't want to be in this mindset of thinking like, well, I need to do a half marathon in order for it to matter, so I'm not going to do anything. If all you can handle right now is like dancing to 5 minutes of your favorite song while you make dinner, and that's where you're at with cardio right now, start there, because it's better than nothing, and that's the first easiest step towards doing more later. So it is worthwhile to practice cognitive skills, but definitely make sure you have an OT or somebody else to help you apply those skills to your everyday life so that you can use them in the grocery store or in conversations or wherever it is you need to use most of your thinking power. And you might want to consider trying to get a little bit of cardio in every week, even if it's just small. finally, last common barrier is our emotional and our mental health. So I have already mentioned that there are higher rates of mood disorder, PTSD, and suicide amongst people who have experienced a brain injury. We do have good evidence. So for concussion, they recommend standard treatment for depression and anxiety. I'll put some resources of how you can access mental health services on the island and in BC. If the standard treatment isn't working out in both concussion and moderate to severe acquired brain injury, you can consult your GP or ask for a referral to psychiatry, but there is some evidence to say that SSRIs, selective serotonin reuptake inhibitors, can be helpful. Again, I'm an OT, I can't prescribe medication, so that's why you're going to talk to a doctor about it. But in general, they don't recommend using benzodiazepines because those things tend to suppress our nervous system and they'll be like downers a little bit more. So if we're working on recovery and trying to be more alert and focused and engaged, we don't necessarily want that effect of something suppressing our attention as much. And for moderate to severe acquired brain injury, one of the highest recommendations is for mindfulness-based CBT that's adapted for brain injury. So if your injury is a little bit more severe, you want to look for someone who has some experience providing mental health services with brain injury. And not all of the mental health substance use teams have an occupational therapist on their team, but it is getting a little more common. That's where I work. And I do know other OTs on the island working at MZUs or mental health substance use offices. If you're really curious about this, I did put in a little visual of the hand model of the brain. You can Google lots of YouTube videos about this that explains how our cognitive functions are affected by stress. So basically, when our brain is calm, it's all under wraps. So this is the limbic system. It's kind of the emotional region of the brain. It's often talked about your brain stem and your spinal cord. Wrapped over it is your cerebral cortex, which is where all of those higher level functions are that we talk about, like planning, organizing. Basically, this is responding wisely, and this is reacting from like an emotional or fear-based or threat-based place. And when we get really stressed, they say sometimes we flip our lid. So these things aren't communicating anymore. So stress, as well, we already said there's high rates of PTSD. This can be a trauma response. Our emotional health affects our cognition as well, and that interacts with the cognitive effects of brain injury. So you want to look at taking care of both things. You're welcome to pause your video here if you're interested in any of these resources of how to access mental health services. And I also did put it on a little list that I sent to Adrienne that she's welcome to email out to folks. The last thing that I'm going to talk about is putting it all together in our daily routine and activity patterns. So none of these occupations happen in isolation. They happen in the context of everyday living. So the three common activity patterns we see after an injury, whether it's a physical injury, a brain injury, anything. So we see total avoidance, where people are just like, I'm out, everything's too hard, I'm not going to do anything. So over time, those folks have an activity tolerance that decreases. We have people who end up into a boom and bust cycle, overdoing it. And you can probably see below boom and bust, I have the little diagram of how this relates to symptoms, whether that's headaches and pain from a concussion or fatigue or frustration from a more severe brain injury. Our activity is related to symptoms. So you might have experienced doing something like the Buffalo concussion treadmill test, where they get you to run and do cardio until you say like, no, I have a bit of a headache. It's like that out of 10. Okay, my headache's 7 out of 10. So you have a certain amount of activity you can do, then you're going to enter into some mild to moderate symptoms and eventually hit this red zone of significant symptoms. And that tolerance, those zones change over time. And the thing that makes them change is our activity patterns, our occupations, and our time use. So if you're starting from a boom and bust or a total avoidance pattern, what we're going to do in occupational therapy and in rehabilitation is try to move you towards a pacing pattern. So you want that balance of activity and rest where you're doing things. You might experience some mild to moderate symptoms, but then you're trained at being able to notice that and take a little bit of a rest and then get back to activity. So instead of the big boom and bust, you have a nice moderate pattern, and over time, your tolerance, that green zone, grows bigger, and you spend much and much less time being symptomatic. So remembering that one of the key values of OT is that occupation organizes our time and structures our day. After an acquired brain injury, when you have these symptoms, sometimes it feels like the symptoms are calling the shots and organizes our time, rather than us choosing and feeling free to do what we want to do and need to do in a day. So the goal of OT and rehab is to put you back in control, to prioritize the activities that you want to do that mean the most to you, and to gradually build up your tolerance to have a full daily routine again. The way we do that, like the diagram said, is through pacing and energy conservation. So balancing activity and rest. There's also a lot of pretty helpful analogies from disability studies, occupational therapy, rehab science. One really common one you might have heard of is the spoon theory. So the idea that spoons are like our energy, and we only have a certain amount of spoons when we wake up in the morning. Everything we do in the day takes our energy or our spoons away. So some occupations are like a one spoon. They're not very hard. So getting out of bed, it takes a bit of energy, but it's not overwhelming. Sometimes it is, but it's usually on the lower end. But it goes all the way up to something like going to work, school, or going shopping might be more of a 4-spoon activity where afterwards we're really drained physically, cognitively, emotionally. So we need a bit of time to recover from that. So energy conservation is the idea of conserving your spoons, saving them for what matters, whereas pacing uses similar principles, but it's more about planning your activity and rest in order to gradually increase your activity tolerance. Again, that was all really, really brief. I was trying not to talk too long and be too boring. So if there's an area of interest you want to dive more into, definitely feel free to access the support of an OT. You're welcome to email me as well. But final thoughts, we're just starting from the basic idea that human beings need occupation and that occupation has therapeutic potential. So doing things often makes us feel better and feel like ourselves again. OT assessment and treatment looks at the person, your environment, as well as all of your meaningful occupations, but always should be focusing on that meaningful activity, getting you back to doing what matters to you. So yeah, the goal is to be able to enable you to do the things you want to do and need to do. All the activities you work on in your rehab plan should be driven by your unique values and goals. So there is some evidence saying that value-directed living is one of the biggest things after a brain injury that works on your resiliency and post-traumatic growth. You want to keep relying on self-compassion. So what you're going through is hard. You need to be able to, support yourself, comfort yourself, as well as push yourself little by little to keep on getting better. Interdependence is very normal. We all need each other, and you might need others a little bit more during your recovery, and that's uncomfortable, but it's okay. And it helps us to grow more than being self-critical, overdoing it, or trying to go it all alone. So that's all the information I had for today. There's a lot that hasn't been said because, as I said in the beginning, they're 2 super broad topics, but this is a starting point. So if anyone has something they want to learn more about, feel free to reach out to myself or Adrian. You can pass along any questions from folks.
Awesome. Thank you so much, Caitlin. I definitely learned a few things. I think it's great to have this resource up on our YouTube channel so that people can go back and watch again and kind of maybe have some better idea of how you could help a person who has some goals. So I just want to say thank you again, and thank you for joining us. We will be recording another one next month, so keep your eye out on our YouTube channel and come check out our website, nbis.ca. Thank you, and bye for now.